Researchers from the public and private sectors announced today our species can now read its own genetic code.
Doctors increasingly will be able to cure diseases like Alzheimer's, Parkinson's, diabetes.
What if you knew that you were at risk for a devastating disease? How far would you go to keep from passing it on to your children?
Question, can human genes be patented?
This map marks the beginning of an era of discovery that will affect the lives of every human being, with implications for history, business, ethics, religion, and of course medicine.
A lot of times I feel that faith communities and the scientific community are at odds with one another. There's very much an us versus them scenario that's set up. And I think that both of those communities could really learn so much from one another and could really enhance that dialogue and really enrich this whole discussion. Thinking about whether or not to terminate a pregnancy that has received a genetic test result that would lead to some sort of devastating illness. That's a topic that even within the faith community, there's a lot of differing viewpoints on that. So some traditions say abortion is completely off the table, and others will say that there are situations where therapeutic abortion is appropriate. So even within the faith community, there's a lot of discussion about that and a lot of disagreement. Many people, I think, that receive very difficult genetic test results may not share it with their faith community. I think because there is a lot of misunderstanding and a lot of fear associated with that, I think the faith community has great opportunities there's great opportunities to educate a large number of people about genetics and genomics and about some of these ethical challenges that arise. Also, I think one of the key things is that if people learn to understand where many of those sticky points are, where many of those real challenges are, where very difficult situations for families walking through some of these genetic situations, there's great opportunities for faith communities to walk alongside these individuals and offer very genuine care and support. And I think that's a really important role that the faith communities could play.